A surprisingly common reason for infertility is painful sex. This is not one of those things people talk about too much, and if you want to find out more about how painful sex affects your fertility and how we can help you and how you can help yourself to have a baby in spite of this problem, please watch the entire video. Sex is supposed to be a pleasurable activity, it's supposed to be fun, which it is for most couples, but for some it's painful. This pain is called dyspareunia or pain during intercourse. It's surprisingly common, but it's not one of those things which people talk about for multiple reasons. For one thing, sex is a taboo topic, it carries a stigma. Second is you don't know whom to talk about with it too. Who do you discuss it? You can't really tell your mother-in-law, your mother perhaps, and you're not even sure whether your doctor cares or is bothered or interested. And it's touchy, sensitive. Should I tell my GP? Should I talk to my gynecologist? And most gynecologists, quite frankly, aren't very interested in stuff like pain during sex because the gynecologists, they're not really very interested in sexual problems, as a result of which the woman can be quite miserable. She doesn't know whom to talk to. She doesn't even know that it's abnormal to have pain during intercourse because she's already had it. And she's always had it. And for all she knows, she says, yes, that's the way it's supposed to be. She might talk to a few friends or maybe sister. It's meant to be painful. It's the man who has fun. The woman's not supposed to enjoy sex. That's still a myth which is very highly prevalent in Indian society, which is very patriarchal. So that they don't even know that it's a problem. They don't even know that they can take treatment for it. There's two kinds of dyspareunia. One is superficial. Superficial means when the erect penis enters the vagina. And there's deep. Deep is during thrusting. Two different levels and require a slightly different approach. Superficial dyspareunia is much commoner, and this often occurs because both the husband and the wife are sexually inexperienced. Often both are virgins, never had sex before, don't know what to do. And trust me, porno sites aren't very reliable as to how to have sex, and unfortunately that's what a lot of people depend on. So often what happens is the man gets the erection, all ready to penetrate. The poor wife is going to take time to get sexually stimulated, aroused, lubricated, but he doesn't know that, she doesn't know that. And she remains lying passively, and he puts the penis inside, and because the vagina is dry, it hurts her. But she keeps quiet and suffers through it and doesn't know any better. And she always wonders, why do people want to have sex? This is so miserable. But part of the problem is that superficial dyspareunia will not cause infertility. But obviously, because of the pain, she won't feel like having sex. The husband is not unkind or cruel. He will not force her to have sex when he can see he doesn't enjoy it. As a result of which the frequency of baby making sex goes down dramatically, and this could be the reason for their being infertile. Common problem? The good news is easy to solve. If it's just superficial dyspareunia, what you need is lubrication. There are lots of commercial lubricants available, very expensive, don't waste your money. All you need is a sperm-friendly lubricant, and you can easily use what is called liquid paraffin. It's available at any chemist. It's used for treating constipation. That's when people drink it. Don't drink it when you're using it for treating dyspareunia. You have to apply it to the vagina, to the erect penis. Use a lot, it doesn't matter. But then it just means that the penis will slip in easily and the pain will definitely go away, and hopefully you'll start enjoying sex too. So that's a simple solution. If your problem is not just superficial dyspareunia but deep dyspareunia, that's pain during deep thrusting, this often suggests that you have a gynecological problem, and a surprisingly common one is endometriosis. Sounds like a mouthful, and you can go to our website at www.drmalpani.com to read about it. But often there are no external symptoms with this kind of disease. Everything seems fine, periods are regular, everything else is okay. It's just that when the husband puts the penis deep in the vagina, because there are endometriotic lesions, often called chocolate cysts in the ovaries, these are painful, they're very sensitive, and they hurt. So that is sometimes a symptom, but a lot of doctors miss it, and a lot of times the woman doesn't even volunteer the information, either because she's embarrassed or because the doctor doesn't ask. In any case, if you think that is a problem, please share this information with your doctor. He will then do a vaginal ultrasound examination to see if you do in fact have a chocolate cyst, and The good news is there's a treatment for all these problems. I'll be discussing these later on, but if you have questions, hey, feel free to email me. The good thing about an email is it's anonymous. Any email you send me on our website at www.drmalpani.com comes to me. It's my personal email address, so everything is confidential. I've been doing this for now 30 years, so I'm very happy to help you solve your problem. And we look forward to helping you to have a baby. See you.